Hi everyone, welcome to our YouTube channel pharmaforge, and today we are going to discuss the topic that is drug use in treatment of the rheumatoid arthritis. Rheumatoid arthritis, it is autoimmune disorder, and it is characterized by the pain in joints, inflammation, and joint pain is there in rheumatoid arthritis, and it is type 3 or means hypersensitivity type of reaction. Means as we know that in type 3 you may heard about the Arthur's reaction, that is nothing but the rheumatoid arthritis, and IgG antibodies are involved in this. Autoimmune disorder means when immune system is hyperactivated, it attack on our body itself. Means it cannot be differentiate in between the self and foreign material. That is the autoimmune disorder. Like that rheumatoid arthritis, it is autoimmune disorder. मीन्स जो कोई भी हाइपर एक्टिव न्यूट्रोफिल्स है, एसिडोफिल है, मैक्रोफेजेस है, वो सभी बोन के कार्टिलेज पे अटैक करते हैं और बोन के कार्टिलेज को डैमेज कर देते हैं, और उसके वजह से कार्टिलेज का डैमेज होने के वजह से जॉइंट में पेन होने लगता है. दैट इज़ rheumatoid arthritis. In case of rheumatoid arthritis, prostaglandin and leukotriene are involved in the progressive damage to the joint, lead to the deformity in bones. मीन्स rheumatoid arthritis में प्रोस्टाग्लैंडिन का रोल होता है, ल्यूकोट्रिन का रोल होता है, विच आर इन्फ्लामेटरी मेडिएटर्स. तो उसके वजह से बोन्स में डिफॉर्मिटी आने लगते हैं. मीन्स डिफॉर्मिटी मीन्स बोन्स जो होते हैं वो टेढ़े मेढ़े हो जाते हैं. दैट इज़ द डिफॉर्मिटी इन द बोन्स. एज यू कैन सी इन द डायग्राम, हेल्दी जॉइंट मीन्स उसमें सिनोवाइल फ्लूइड है, प्रॉपरली है. और इन केस ऑफ द rheumatoid arthritis, due to the hyperactive immune system, cartilage is damaged, and due to that bones में डिफॉर्मिटी आ चुकी है, और उसके वजह से इन्फ्लामेशन है, रेडनेस है. और rheumatoid arthritis जो होता है वो मल्टीपल जॉइंट्स पे होता है. और ऑस्टियो अर्थराइटिस जो होता है वो बोन की वियर एंड टियर के वजह से होता है. ऑस्टियो अर्थराइटिस इज़ नॉट अ ऑटो इम्यून डिसऑर्डर, बट rheumatoid arthritis इज़ अ ऑटो इम्यून डिसऑर्डर. एंड ऑस्टियो अर्थराइटिस जो होता है वो स्पेसिफिक लोकेशन पे ही होता है ओनली, और rheumatoid arthritis जो होता है वो बहुत सारे मल्टीपल जॉइंट्स को टारगेट करता है. दैट इज़ द डिफरेंस इन बिटवीन द ऑस्टियोआर्थराइटिस एंड rheumatoid arthritis. So firstly, when we talk about the drug that are used to treat the rheumatoid arthritis, painkillers means non-steroidal anti-inflammatory drugs are used in patient, that is aspirin, ibuprofen, naproxen, piroxicam, to reduce the pain in joint. Then second class of drug is a DMARD, means disease modifying anti-rheumatoid drug. Disease modifying anti-rheumatoid drug. So in this class, methotrexate is there, azathioprine, then sulfasalazine, leflunomide, chloroquine, gold compound, that is auranofin, and d-penicillamine. Again I am repeating it. First is a methotrexate, second is a azathioprine, third is a sulfasalazine, leflunomide, chloroquine, auranofin, and d-penicillamine. These all drugs are used in process to avoid the progression of the cartilage damage which occur in rheumatoid arthritis. And third class of drug, that is biological agent, means different inflammatory mediators are involved in the inflammation in case of rheumatoid arthritis. So they need to be inhibited. In case of inflammation, the role of TNF alpha or IL-1, that is interleukin 1, or T cell or B cell, this is their role is important. So their inhibitors are used in treatment of the rheumatoid arthritis. So TNF alpha inhibitor category drug, that is etanercept, infliximab, adalimumab, and IL-1 antagonist, that is anakinra, uh, and T cell modulating agent, that is abatacept, and B lymphocyte depleter, that is rituximab. So this classification is very important of the drug used in treatment of rheumatoid arthritis. This classification part is important. So one by one we will see all the drug. First drug is a methotrexate. Methotrexate is a first choice drug that is used to treat the rheumatoid arthritis. Methotrexate, it is a dihydrofolate reductase inhibitor, and it is used in treatment of the cancer also. And in methotrexate, when we use in treatment of the rheumatoid arthritis, it is responsible to stimulate the apoptosis in inflammatory cells. Apoptosis means programmed cell death. And methotrexate also inhibit the proliferation of the activated T cells, and cytokine production is also inhibited by the methotrexate. Uh, and methotrexate causes the megaloblastic anemia. Then second drug is a sulfasalazine. Sulfasalazine is a second line drug that is used in the treatment of the rheumatoid arthritis. And actually sulfasalazine, when undergo metabolism, it gives two metabolites. First metabolite is a sulfapyridine, and second metabolite is a 5-amino salicylic acid. So this sulfapyridine, which is metabolite of the sulfasalazine, this sulfapyridine, it is easily absorbed in the blood, and so it is used in treatment of rheumatoid arthritis. But 5-amino salicylic acid, it do not undergo absorption, so it remain in the gut as it is, and it is useful in the treatment of the ulcerative colitis. And third drug is a azathioprine. Azathioprine, it is a purine analog drug, and it inhibit the synthesis of the purine. Azathioprine converted into its active metabolite 6-mercaptopurine, and it inhibit the conversion of the ionosine monophosphate to adenine and guanine nucleotide, and it incorporates itself into the DNA. This mechanism of the azathioprine is used in the treatment of the cancer, and in case of the rheumatoid arthritis, this azathioprine, it is responsible to suppress the cell mediated immunity. And chloroquine, as we know, it is anti-malarial drug, and chloroquine is a drug with the highest volume of distribution, and chloroquine causes the retinal damage also. And in case of the treatment of rheumatoid arthritis, chloroquine reduces the monocyte interleukin 1 to beta lymphocyte. Actually the mechanism of action of chloroquine, exact mechanism is not known, but still it is useful in treatment of rheumatoid arthritis. Then next drug is a leflunomide. Leflunomide is converted to its active metabolite, and it inhibit the dihydroorotate dehydrogenase. And dihydroorotate dehydrogenase, it is required for the pyridine synthesis, and leflunomide side effect is a loose stool, but it is effective drug in treatment of the rheumatoid arthritis. Then second is a gold compound, that is oranophine. It is orally active gold compound, and it inhibited the cell mediated immunity. Then next drug is a D-penicillamine. D-penicillamine, it is used to treat the Wilson disease. Wilson disease occur due to the copper poisoning. So this all are the disease modifying anti-rheumatoid drug means first we have discussed about the methotrexate. Methotrexate inhibit the proliferation of the activated T cell. It also inhibit the production of cytokine and promote the apoptosis. Apoptosis means program cell death of the immune cell. Next drug is a sulfasalazine. Sulfasalazine is a second line drug, and methotrexate is a first line drug to treat the rheumatoid arthritis. Sulfasalazine, its metabolite sulfapyridine is used in treatment of rheumatoid arthritis, and 5-amino salicylic acid, it is used to treat the ulcerative colitis. Then third drug is azathioprine. Azathioprine, it is a good immune suppressor drug. Cell mediated immunity is inhibited, and azathioprine also used in treatment of the cancer because it is purine analog drug, and it get incorporated into the DNA. Next drug is a chloroquine. Exact mechanism of action is unknown, but it is efficiently used in treatment of the rheumatoid arthritis. And leflunomide, it inhibits the dihydroorotate dehydrogenase that is involved in the pyridine synthesis, and gold compound, that is oranophine. And next drug is a d-penicillamine. So डिसीज मॉडिफाइंग एंटी रूमेटॉइड ड्रग मीन्स ऐसी ड्रग की जो डिसीज़ का प्रोग्रेशन होने से, डिसीज़ का बढ़ने से डिसीज़ को बढ़ने से रोकती है. दैट इज़ मिथोट्रिक्सेट, एजाथायोप्रिन, सल्फासालाजिन, लेफ्लुनामाइड, क्लोरोक्विन, देन डी पेनिसिलामाइन. एंड बायोलॉजिकल एजेंट्स मीन्स ऐसे एजेंट की जो इन्फ्लामेटरी मेडिएटर्स को कंट्रोल करते हैं, क्योंकि रूमेटॉइड आर्थराइटिस में TNF अल्फ़ा के वजह से इन्फ्लामेशन होता है, इंटरल्यूकिन 1 के वजह से इन्फ्लामेशन होता है, और टी सेल और बी से लिम्फोसाइट का वहाँ पे माइग्रेशन होने के वजह से ये जो प्रोसेस है इन्फ्लामेशन की वो बहुत प्रोग्रेशन में आ जाती है. तो इनको कंट्रोल करने के लिए उसके इनहिबिटर्स दिए जाते हैं. तो दैट इज़ TNF अल्फ़ा इनहिबिटर, दैट इज़ इटानरसेप्ट, इन्फ्लिक्सीमैब, अदालीम्यूमैब, एंड इंटरल्यूकिन 1 एंटागोनिस्ट, दैट इज़ एनाकिंद्रा, टी सेल मॉड्यूलेटिंग एजेंट, दैट इज़ अबाटासेप्ट, एंड बीटा लिम्फोसाइट डिप्लीटर, दैट इज़ रितुक्सीमैब. सो हमने देखा कि रूमेटॉइड आर्थराइटिस में एक्चुअली क्या होता है. तो रूमेटॉइड आर्थराइटिस टाइप 3 रिएक्शन है, और उसमें IgG एंटीबॉडी इन्वॉल्व है. आर्थस रिएक्शन उसे कहते हैं, और उसके इसमें होता है कि कार्टिलेज का डैमेज होता है, और कार्टिलेज का डैमेज होने से बोन्स में डिफॉर्मिटी हो जाती है और पेन होने लगता है. तो इसके ट्रीटमेंट के लिए कैसे ड्रग दिए जाते हैं, उनका मैकेनिज़्म ऑफ एक्शन क्या है, ये हमने इस टॉपिक में देखा है. थैंक यू.